Shadow Health Secretary Wes Streeting wrote his article for The Sun today about Labour's plans to use the private sector to reduce NHS waiting lists. Streeting said the party will take on middle-class lefties who are opposed to it. The Shadow Health Secretary also said that Labour wanted to build a cross-party consensus on social care funding. Well, earlier on, I spoke with Dr John Puntis, the co-chair of Keep Our NHS Public. John, these howls of outrage, are they coming from you?
Not a howl of outrage so much as extreme disappointment at the lack of ambition coming from the Labour Party for the NHS. So, thinking back to 1948, when we had a massive debt related to GDP, and yet we built a national health service. And partly that was because of a recognition that if you wanted to have a strong economy, you first needed to have an effective, strong health service. So I'd like to see more of that kind of thinking. But it's disappointment, really, as much as anything, because I think we really do need to have evidence-based policies. And it sounds great to say, let's send patients to the private sector. The private sector is very small and it does not really have spare capacity. It gets its staff from the NHS. My colleagues at work who used to do private practice, some of them would do a bit at the weekend, but many others would say, I'm not working in the NHS on Fridays because that's my day when I go to the private hospital. The only way it would have additional capacity is if it has government investment. And that money, frankly, should go into the NHS. Yeah. If we seriously want to tackle the major long-term problems of the NHS, building a two-tier system is not the answer. So my main criticism is actually there is not spare capacity in the private sector. If Wes Streeting thinks there is, I'd be very interested to see the figures. But, last year, the private sector did about 100,000 NHS elective operations. The NHS did 80 times that number, 8 million. And the same is true of things like diagnostic tests and day cases. And of course, the private sector doesn't do any emergency stuff. It doesn't have ITU facilities, and it actually transfers nearly 7,000 patients a year into the NHS because of complications that have happened in the private hospitals.
Well, but we do know, John, don't we, that a lot of people have felt forced to go for private treatment because of the waiting lists on the NHS. So by definition, there has been space that has been occupied in the private sector over the last couple of years because of COVID and many other things. So what do you take from Wes Streeting's argument that he couldn't look someone in the eye and tell them they should wait longer because their principles trump their timely access to care?
Well, I would challenge what you say. I mean, if you look at the figures in the private sector, not only are they small, but they actually haven't gone up very much at a time when you'd think demand would be driving up the numbers. But actually, they dealt with about 3.5% more patients. So the evidence somehow they're booming is a misrepresentation that comes from the private sector, who are more than happy to say that they're there to help out the NHS, but only on the basis that they will then expect investment to come to them in order to expand their services. So the evidence actually suggests that they've got very limited capacity.
Can I just get your thoughts relatively briefly, if I can, on the other thing that Wes Streeting talked about today? And that was the idea of, potentially a cross-party consensus on social care. What hope have any incoming Labour government got, do you think?
Well, we need to have a radical reimagining of social care. We need to do something about the millions of unpaid carers, 800,000 of whom are children. We actually need, I think, to have social care funded out of general taxation, similar way to the NHS. And there needs to be an absolute recognition of the huge burden that's being placed on many people through lack of social care support being available. This does have a considerable impact on the NHS, of course, but that's not the main argument in wanting to sort out social care, but it needs a much more radical thing, and it needs service users, disabled people as well to be involved in designing services. And Labour's coming nowhere near such a radical vision at present.
Dr. John Puntis, the co-chair of Keep Our NHS Public, talking about the Shadow Health Secretary, Wes Streeting, and his plan to use the private sector to reduce NHS waiting lists. Streeting said the party will take on middle-class lefties who are opposed to it.